The deformity in idiopathic scoliosis is complex and three-dimensional, involving three key components: lateral curvature, vertebral rotation, and sagittal imbalance. Each of these elements needs to be assessed and addressed separately in clinical evaluation and treatment. Among the various measurement methods, the Cobb angle stands as the gold standard for diagnosis and monitoring of changes in adolescent idiopathic scoliosis. However, the Scoliosis Research Society recognizes that the Cobb angle alone cannot fully describe all scoliosis features, making it insufficient as a sole monitoring parameter. While computed tomography can provide highly accurate three-dimensional spine reconstructions, its use for routine monitoring is limited due to radiation exposure concerns. As a result, standing postero-anterior full-length spine X-rays remain the primary imaging method for diagnosis and monitoring. Long-term outcomes in surgically treated cases depend not only on coronal correction, but also on the restoration of sagittal curves, highlighting the importance of comprehensive measurement approaches. The Cobb angle measurement technique, first described in 1948, involves drawing lines parallel to the vertebral plates of neutral vertebrae and measuring the angle formed by their perpendiculars. Stages of Cobb angle measurement are 1. Identify the apex of the curve, the vertebra most deviated from the midline. 2. Locate the end vertebrae, the most tilted vertebrae above and below the apex. 3. Draw lines along the superior end plate of the upper end vertebra and the inferior end plate of the lower end vertebra. 4. Extend these lines until they intersect, or draw perpendicular lines if they do not meet. 5. Measure the angle formed between these two lines. Interpretation of Cobb angle. Cobb angle less than 20 degrees represents mild scoliosis. Cobb angle between 20 and 40 degrees represents moderate scoliosis. Cobb angle more than 40 degrees represents severe scoliosis and often requires surgical intervention. Sagittal balance method evaluates the alignment of the spine in the sagittal plane, side view, by measuring the horizontal distance between the C7 plumb line and the posterior superior corner of the sacrum. It assesses whether the spine is balanced or if there is forward or backward displacement of the head relative to the pelvis. Stages of sagittal balance measurement are 1. Draw a vertical line from the center of the C7 vertebral body to the sacrum. 2. Measure the horizontal distance between this line and the posterior superior corner of the sacrum. Interpretation of sagittal balance method. Distance between 0 to 2 centimeters is normal. Distance more than 2 centimeters means head is too far forward. Distance more than -2 centimeters means head is too far backward. Thoracic kyphosis angle measures the curvature of the thoracic spine in the sagittal plane. It is typically measured between the T1 and T12 vertebrae. Thoracic kyphosis angle evaluates hyperkyphosis, which is excessive forward curvature, or hypokyphosis, which is reduced curvature. Stages of thoracic kyphosis angle measurement are 1. Identify the superior end plate of T1 and the inferior end plate of T12. 2. Draw lines along these end plates and extend them until they intersect. 3. Measure the angle formed between these lines. Interpretation of thoracic kyphosis. Angle. Thoracic kyphosis angle less than 20 degrees represents hypokyphosis. Thoracic kyphosis angle between 20 and 40 degrees represents normal thoracic kyphosis. Thoracic kyphosis angle more than 40 degrees represents hyperkyphosis. Lumbar lordosis angle measures the curvature of the lumbar spine in the sagittal plane. It is typically measured between the L1 and S1 vertebrae. Lumbar lordosis angle measures excessive lordosis or reduced lordosis. Stages of lumbar lordosis angle measurement are 1. Identify the superior end plate of L1 and the superior end plate of S1. 2. Draw lines along these end plates and extend them until they intersect. 3. Measure the angle formed between these lines. Interpretation of lumbar lordosis angle. Lumbar lordosis angle less than 30 degrees represents hypolordosis. Lumbar lordosis angle between 30 and 80 degrees represents normal lumbar lordosis. Lumbar lordosis angle more than 80 degrees represents hypolordosis.